Hi everyone, welcome to week 8 of your Law and Ethics for Pharmacy Technicians. This week we are covering Chapter 7, which is all about workplace safety laws. Most of you are probably already familiar with the main workplace safety law that is a federal law, and that is known as OSHA. OSHA stands for the Occupational Safety and Health Administration. So it's really been developed to help maintain reporting and to keep track of job-related injuries and illnesses, as well as to reduce those injuries and illnesses. So it actually covers a variety of different things. Those things include air contaminants, eye and skin protection, flammable and combustible liquids, and hazard communication standard. So when we look at some of those different things that fall into these different buckets, the regs are covered pretty much anything and everything that you can think of in the workplace. So it's, paperwork stuff. So that's what the administrative requirements are about. How to administer first aid, how to deal with different machinery and equipment and other materials, the actual physical workplace and the safety of that workplace, the different power sources that are used for some of the things in the workplace, processing when things do go wrong, protective clothing, all of those types of things. So OSHA is authorized to do quite a few things, and that includes establishing different safety and health responsibilities to make sure that safety is the key, utmost, that there is the utmost safety in a workplace situation. So the idea is, reducing the amount of hazards that are out there, maintaining records so that, obviously you can prevent things in the future. There's different risk assessments that are done, things like that. So probably in the healthcare industry, the most important one that you're going to run across is the things having to do with bloodborne pathogens. So a bloodborne pathogen is just defined right here as any infectious microorganism that's present in blood or other body fluids and tissues. So it's not just blood. It can be in other fluids as well. And obviously, it's one of the most significant biohazards that we would face as a healthcare worker. Now, obviously, depending on where you work, you're going to have more or less exposure to these different biohazards. Obviously, if you work in an acute care setting, maybe if you work in a nursing home, things like that, you're going to have more opportunity to come in contact with these than you wouldn't if you worked in a retail setting. But regardless, you're still going to run across these. Some of the bloodborne pathogens include HIV, Hep B, and Hep C. So the idea is that you need to know about these different dangers, and then what would you do? What are the things that are already in place to help protect you from exposure, and what would you do if you had exposure? Obviously, we want to make sure that we reduce the chances of exposure. So the big part of that is universal precautions and using aseptic technique. So that helps to minimize the chance of contamination by some of these bloodborne pathogens. But then, of course, what if something does happen? We have to have some sort of post-exposure follow-up. How do we label things? How do we deal with housekeeping and the laundry around these types of things? And then, of course, training. So again, that's a huge part of anything, is making sure that we know what we are doing, so that we can avoid any type of exposure. So aseptic technique the goal of that is to minimize your contamination. And the idea is we have to follow a controlled, specific set of practices and procedures. And those include things like cleaning, sanitizing, disinfecting. All of those things are part of using aseptic technique. And so in the pharmacy, we typically call it a clean technique for sterile compounding, things like that. So the USP is actually the group who details all the different procedures for compounding in sterile environments. So we want to make sure that we are following those guidelines. One of the pieces within that guideline is what we call PPE, personal protective equipment. So this is things like eye wash stations, making sure that you are wearing gowns or lab coats, goggles, masks, gloves, all of those types of things. And then, of course, in addition to your PPE, we're also looking at, how do we avoid exposure? What are the things that we make sure that we do so that we don't have exposure? And then what are those types of exposure? Again, Hep B is you can be vaccinated against that. So that's a great way to make sure that we are limiting our exposure to those types of things. But in the case that we might have exposure, the plan also should include the post-exposure procedures and what do we do with those. So all of those topics are included this week in the material, as well as, OSHA training, how do you handle chemical spills, what if you have a fire, what if there's some sort of electrical problems. All of those things are included this week in your chapter, as well as tracking medical waste, and even things like sexual harassment. So if you have any problems or questions this week as you're going through the material, please make sure that you reach out to me, and have a great week.